Hi, I'm back, and we were just talking about the importance of getting identification from people who come into your home saying that they are there to do whatever services, whether it's medical services or maintenance on your home or appliances. Please, we want you to be safe. Get identification. And if you don't feel right about this person, then make a phone call. You are not required to open your door to anyone if you don't have an appointment, if they have not set up an appointment with you in advance. In terms of the Medicaid waiver, let's talk about some of the services that are available once you get approved for Medicaid waiver. The Medicaid waiver program is a wonderful program. My mother was in the program when I was working. And when I was working, I did not have supportive supervisors, and it can be very difficult if you don't have a good support system in your family and even your extended family. And that extended family is a part of your work environment can become a part of your extended family as well, because we spend so much time at work and with the people for whom and with whom we work. So it's very, very important to have a good support system. I didn't have that. So my mother was in the Medicaid waiver program, and it allowed me to work and know that someone was home with my mother taking very good care of her. Some of the services, the 6 services that come with the Medicaid waiver program are, first of all, personal care assistance. Or some people say home health aid assistance. And what the home health aid does when they are working in the homes of people include helping people get their baths so they don't fall and hurt themselves. Some people, many seniors and people with disabilities and people with chronic illnesses are afraid to get in the bathtub because they are afraid that they cannot get out of the tub and they are home by themselves. We know of situations where people have gotten stuck in the bathtub, and some people have remained in the tub for more than a day or so because they could not get out. They had no one to check on them on a regular basis. So personal care assistance is one component of the waiver program. They help you get your bath. They can help go to the store and do grocery shopping, run medical errands such as picking up prescriptions. Your home health aide can even accompany you to the doctor and ride on the Metro Access bus or the WETS van to ensure that you get on and off the van without hurting yourself. They help prepare meals. They cook. Now, a lot of people have some issues in the area of cooking because some people don't cook the way perhaps that you would cook. Well, what you would do in a situation like that is to work with your home health aide and train and teach him or her how to cook and behave in your kitchen the way that you would want them to behave in your kitchen. So those are some of the things that the home health aide is allowed to do. Then another component of the Medicaid waiver program is the personal emergency response system. This is really a wonderful component of the Medicaid waiver program because the government wants you to remain safe in your home. So we have a system called the Personal Emergency Response System, which is monitored 24 hours a day, 7 days a week, and you are provided with either the pendant that you would wear around your neck, or some people opt to wear the wrist pieces like a watch, And in the event that you have an emergency, if you fall or if you feel faint, you're going to have a heart attack or whatever your concern is, you simply push the button around your neck or on your wrist, and a live person will come on to find out what your issue is. And if it's a serious emergency, they will call 911, and they will then alert any caregiver, whoever you have indicated you wish them to call. They will call that person and let them know that there has been an emergent issue with you and give them a status update. It's a wonderful program, and the government wants you to have it. Another component is called respite, and respite is provided when recipients of the waiver program live with people. If you live with a child or you live with a spouse or whoever you live with, in the event that that person is away from the home 20 times a year, the government will pay for 24-hour care for you in your home. In the event the caregiver could get sick, him or herself, and end up in the hospital and not want to leave you home alone, the government would allow 20 days when you could have 24-hour care. So make sure when you are assessed for the Medicaid waiver, make sure that your case manager includes respite in your service plan. That's very important. And respite is also used to keep the caregiver from becoming burned out. People who love their parents, their spouses, and their friends, caregivers, many of them, they go out of their way to take good care of the people in their lives. And oftentimes they do that to the detriment of their own health. So we encourage people to take advantage of the respite, even if it's a night out. If you are a married couple and you are taking care of your mom or your mother-in-law, then have a date night out sometimes where you can just go out and just forget about everything and enjoy yourself, or take some of that time to go to the gym and take some time out just for yourself. Is very important, because you, the caregiver, you are the backbone of our support system. We can't do it without good care givers. And we also have nurses who visit once a month or as medically necessary to ensure that there is good collaborative care between the primary care physician, the case manager, the community, and the client. And this is where if say for instance the nurse comes out and she feels that a client's blood pressure is running averaging a bit high, then the nurse has the opportunity to call the primary care physician, and let the doctor know that I checked Miss Jones' blood pressure the last 3 or 4 months and it seems to be running high. Perhaps we need to look at the medications that she's on. Or it could be a situation where the nurse might notice that the waiver beneficiary is moving a little more slowly than they normally move or get around. So that could be an indication that perhaps a medication could be affecting their mobility. So the nurse can run that interference and collaborate with the medical team to let them know that perhaps some action is indicated because of that. And case management, the RN who comes out to make sure that people are okay medically monthly, also works closely with the case manager. The case manager, in this case, being me, and case managers might also be a social worker like me, an RN. Case managers also might be an occupational therapist or a physical therapist. And all of these people from these various disciplines bring their own unique skill set and professional experience. And it's wonderful that we have such a diverse group of people as case managers, because the occupational therapist, who is your case manager, will see things that perhaps the case manager may not see. So there is a good opportunity for collaborative care so that you can be taken care of all just in a wholehearted way. And the social workers, the case management, we specialize on connecting people with available resources in the community. And I love Washington, D.C. I love Washington, D.C. because of all of the wonderful resources that we have here. Other jurisdictions don't have the resources that we have here in Washington. And except for the housing piece, the resources we have are just wonderful. Did you know that there is a senior service agency in each ward that does nothing but take care of seniors and people with disabilities in that particular ward? We are going to take another break, and when we come back, I'm going to talk to you more about some of the community resources and the relationship between the case managers and these community resources. See you in a bit.
Hey, Shirley, this is actually closing out the show.
Oh, okay, great. Okay, so let's do it again. Okay, tell me when. This concludes today's show on how to get the most from your Medicaid waiver services or how to get Medicaid waiver services. So stay tuned for more shows that I will be bringing you. I'm excited about bringing these shows to you, and I look forward to joining you in your living room or your office the next time. Take care and stay safe.